Respiratory 1 Case Study. The client is a 68-year-old retired engineer who comes into the community health clinic complaining of shortness of breath, a cough, and lung congestion. He is reporting that he's had a cold for the last week and it's progressively worsened over the weekend. The client states that he had a wet cough and says, "I'm coughing up a large amount of thick yellow-green mucus several times a day." He reports, "I've been taking Robitussin, 1 tablespoon every 6 hours for the cough, but it is not helping. I think I need an antibiotic because my wife was recently diagnosed with pneumonia." The examination shows general fatigue for the last 3 days, the productive cough with yellow-green mucus, shortness of breath rated at a 2 out of 10, and this has been over the past 24 hours. Denies chest pain, reports a fever of 99.9 degrees Fahrenheit orally, but yesterday only. Smokes 10 cigarettes per day for the past 33 years. Reports having the Pneumovax vaccine at age 60. Denies a recent chest x-ray or purified protein derivative skin test. Denies chest pain or orthopnea, and reports sleeping on 1 pillow at night. So now we need to select the relevant cues from this case study. After that, then we will analyze or interpret the cues that we have identified, and then we will list potential solutions or interventions for each one of those cues. So the cues that I have identified are fatigue, yellow-green sputum, shortness of air, elevated temperature, history of smoking, sleeping with his head elevated, 1 Pneumovax vaccine, and the Robitussin is not helping. So now we need to analyze each one of those cues that we've identified. So the first one was fatigue. Maybe it's due to exertion. He's been working, exerting himself somehow physically. It could be from insomnia or an illness or infection. Potentially depression. Depression causes fatigue. Or malnutrition. So the second cue was shortness of air, potentially caused by exertion, maybe anxiety, or a respiratory illness or infection. The third cue is that yellow-green sputum. What could potentially be behind this? Respiratory infection, a respiratory disease. And how about the elevated temperature? What could potentially be causing that? Exertion. There might be too many layers, whether it's bedding or clothing. It could be an illness or infection. Maybe the environment. If it's hot outside, we get hot. Then we move on to the history of smoking. We can't really determine causes other than maybe it was a learned behavior, etc. So let's look at implications. What could happen because this client is a smoker? Well, it increases the risk for lung cancer, respiratory disease, and respiratory infections. The fact that the client sleeps with the head elevated, what are implications of that? Well, this is the definition of orthopnea, even though the client denies orthopnea. Orthopnea is basically unable to sleep or rest laying in a supine position. One pneumavax. What are the implications of that? Well, this is a vaccine that requires at least 2 vaccines for full coverage. So if the client has only had one vaccine, it may not be effective. So just for your reference, and we will discuss it later on in the semester, the clients who are 19 to 65 years of age, if they are smokers, all of them are uh, recommended to have the Pneumovax vaccine. However, if they're non-smokers, we usually don't recommend the Pneumovax until age 65. The Robitussin is not helping. What could be behind that? Well, maybe it's the wrong medication. Maybe it's the wrong dosage. Or maybe it's improper administration. The client said that he was taking 1 tablespoon every 6 hours. Is that the appropriate frequency? So now we need to determine interventions for each one of those cues that we've identified. Fatigue. Well, we need appropriate rest versus exertion ratio. We need to make certain that the client is getting appropriate sleep. We need to maybe explore the possibility of an infection, or if they do have a respiratory illness or some type of overarching illness, we need to make sure that the treatment regimen is appropriate. Client may require some antidepressive medications or maybe even reviewing some coping strategies. And making sure the client has a healthy and adequate diet. What about the yellow-green sputum? Well, we need a culture of that sputum because if it's yellow-green, probably an infection going on. We need to make sure we know what bugs are growing in that sputum. Then we would need to administer the appropriate antibiotics. Maybe give a mucolytic so the client is coughing up the mucus. And make sure that we have appropriate humidification. We need to keep those secretions moist so the client can cough them up. If they're dry, they become really sticky and very difficult to expectorate. This would also include increasing the oral fluid intake. How about shortness of air? Well, the client may need some oxygen. We may need to provide additional rest periods within the activity. Maybe we need to elevate the head of the bed. This will allow the diaphragm and the lungs to expand better. What do we do for the elevated temperature? Well, let's remove layers to start with. We can put a fan on the client or increase oral fluid intake. Maybe give some of those antipyretics. Put cool compresses or cloths on the client. We can put them on the head or the neck. Cold packs underneath the armpits or across the groin. Those areas that are highly vascular where the blood is close to the surface, and that will allow the blood to be cooled by that cool compress or ice pack. A tepid bath. This is not cold. It's more just kind of lukewarm. What about the history of smoking? What interventions do we do here? Smoking cessation. How about sleeping with the head elevated? Maybe we should consider a sleep study to make sure that The client isn't having issues with respiration such as sleep apnea. The one Pneumovax vaccine, well, we need to educate this client because it does require at least 2 vaccines. And the Robitussin not helping, we either need to change the medication, change the dosage, or change the administration of the medication.